Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you very much for having me on this program.
Yes, sir. I wanted to start off by asking you about the campaign drives that we've had. We've had a few special ones, and this is added to what you already had in place. So, if we can talk about what the response has been like, especially where you're getting assistance from the private sector and so on.
I think by and large the campaigns have been good, and we have been working, as you said, with various partners. So we've been working with a lot of faith-based organizations. Some of these are national bodies, others are more community-based, and they have all responded well because they help us to mobilize the community. We have also worked with a number of workplaces, and they too have mobilized their workers so that we can immunize those persons. So I think these partnerships have been working. I would like to see more partnerships, of course, in Bartica, Region 7, and some of those communities in Region 7, Region 8. I would like to see more partnerships, of course, in Region 10, because Region 7, 8, and 10 have been the regions where we haven't seen a lot of vaccination, and Region 10 especially because they are lagging behind everybody else with about 8.6% of the adult population being immunized. So I think a lot more work can be done there, and if there are persons in the community in Region 10 who would like to assist us, if there are organizations out there that would like to partner with us for us to roll out some immunization drives there, then we'll be happy to do so. So they can contact the ministry and we'll work with them to make sure that we reach out to their constituents.
Okay, thank you, sir. There have been some reports of increased cases in Region 9. Have such reports reached your desk?
Yeah, as you know, we monitor what is happening across the country on a daily basis. So the RHOs obviously would have been reporting the cases, and when we do PCR testing, most of those tests would come to Georgetown for testing. So we are aware of the cases that we have, where they're located, communities, and so forth. But while we see that over the last couple of weeks, we have seen some increase in Region 9, there are other regions that we have seen increases in as well. So for today, our cases, active cases, are about 1,971, and we have several hotspots in different regions. So I would say in Region 2, the hotspot there would be Good Hope, where we have about 16 cases in and around that Good Hope area. In Region 3, over the last couple of weeks now, the hotspot there would have been in Tushin, and we continue to see cases in Tushin. And right now we have 39 active cases in Tushin. In Region 4, on the East Bank, we have seen Diamond consistently having cases, and as of today we have 46 active cases in Diamond. In Georgetown, the Sophia Kitty area has been a hot spot, and in Sophia we have about 30 cases. In Kitty we have about 24 cases, and there are other parts of the city that would have between 15 and 20 cases. So we also have to be mindful of these. On the East Coast, we have Mount Repose having about 15 cases. Then in Region 6, New Amsterdam, we have seen about 27 cases in New Amsterdam. In Region 7, Bartica has about 58 cases. In Region 9, as we spoke about just now, we have seen about 21 cases in Aishalton. So we know over the last week or so, there have been a few cases there, and it's now about 21, and we have been monitoring them. The concern, because I just told you about the rates of vaccinations in Region 10 is the lowest, and in the Amila ward area, we have 50 cases right now in that area. So that's an area of concern as well. So one, we have cases that are increasing in areas of Region 10, and at the same time, we have reluctance or hesitancy in terms of taking vaccines. So those two can be a deadly combination. So again, we need to be mindful, and I think the people there should come forward and start getting immunized, or else we'll see many more cases.
All right. I have two follow-ups for you. I wanted to find out what is common among these particular areas that have shown increases. And aside from that, I don't want to diminish anyone's concern, but in respect to Region 9, I know most of the first thing that people talk about is the variant, but I wanted to talk about the particular measures that the ministry has in place. I know that you're monitoring, but that is not the only thing that's happening.
I don't know why people might have concerns about, one area or the other. What we need to do is to make sure that we enforce the public health measures in all the areas. And that being said, those measures really work once we implement them comprehensively. So those measures are that we need to wear our mask constantly and not wearing them under our chin or under our noses and stuff like that. So we need to really implement those public health measures. And the other thing is crowding and avoiding crowds and keeping social distancing. We have seen too many people who have become very complacent, not abiding by these rules, and because of that, we are going to continue to have spread. Now, the concern with Region 9, of course, is that the issue, we have a large land border with Brazil, and we still see cases, you know, in Brazil, and the fear is that persons who are commuting back and forth can bring maybe those cases to Guyana. Since January, we have worked very hard to restrict movement across the land border and across the air border. And we have the joint services really working very hard to restrict movements. Now, despite our best efforts, I'm sure there might be people who are slipping over. But nevertheless, when we become aware of this, and if we become aware of a case, we try to put all the protocols in place to make sure that it is contained. And right now, with the cases that we have seen in some of the communities, our health team have already gone out to those communities, have already worked with those communities, advised them on the protocols they need to take. And so we're trying to contain the cases. We have had from one community people who came down to Lethem to do shopping. And when we tested some of those persons, they were positive, so we are currently confining them in Lethem for the next 10 days. And so they'll be in isolation for 10 days, and after that, then we'll allow them to return to their community. So there are lots of proactive measures that are being taken in those communities. But again, we have to be very vigilant.
All right. Let me just go quickly. I'd ask you what is common among these particular regions, but we spoke about that before. The persons are not observing the basic guidelines and so on. But I wanted to ask you, with respect to persons 18 years and older, have they had any particular concern reported outside of the usual, of course? Anything new?
Um, what we want is to encourage everybody to really come forward and to get their vaccines. What we have seen is that based on our records in terms of immunization, we have seen quite a good uptake with persons 60 years and above. And so in that age category, we have 61.3 percent of persons 60 years and above who would have already taken their first dose of the vaccine. And that's good. We would like that to go up to about 80%, so we still have a little bit more to go. But we knew that this age group was quite vulnerable because we were seeing a lot of them getting sick coming into the hospital and some of them getting into the ICU. So, while this is a good number, we still want to move that up to the 80s, possibly the 90s. So we have some work to do. So if you know of anyone who is 60 and above, we need to encourage them to still come out and get their first dose. But this is a good number so far, and I'm sure over the next couple of weeks we can get to that 80, 90%. In terms of the 40 to 59 age group, we have about 28.6% of those persons receiving at least their first dose of the vaccine. So again, if we're going to get to about 80, 90%, we have a far way to go. So this age category is a very important one. Now, what we have noticed over the last couple of months is that we are seeing in the hospital more persons within this age category coming into the hospital. And we are also seeing from some of the deaths, and those persons who have been following those things in the newspaper would have seen that we are getting some of the deaths within this age range. And as we have said before, the vaccines that we are giving, once you're fully vaccinated, that it can prevent deaths, it would reduce hospitalization. So again, my appeal would be to this age category that if you have not received your vaccine as yet, make a special effort to go out and get your vaccines. And then for the 39 to 18 age group, that one is really lagging because we are just about 20.9%. So it is something that we have to work on, the younger people, to come out and get their vaccines as well. I think they have heard in a lot of the pronouncements that maybe younger people are going to get a milder form of the disease or they're going to be asymptomatic, but there are still a few who would end up in the hospital. And then we have to also consider that when young people get a milder form of the disease, that you can also get long COVID and you can have other forms of COVID that we are now discovering in terms of prolonging of some of these symptoms. So the better thing would be for you to get immunized and make sure that you avoid getting the disease. As of yesterday, I think we have achieved another milestone, a good one that is, and we have been able to immunize 150,694 persons with the first dose of the vaccine. That would put us, for persons 18 years and older, at 31% of our population. So I think that's a good milestone that we have accomplished, and we should all celebrate this milestone because it is people coming out to get their vaccine and the hard work of the health staff who are across the country doing this job. So I want to commend the health team that has been at this for several weeks now, distributing vaccine and making sure that it gets into people's arm, and also everyone who came out, volunteer, and then some people who mobilize communities to make sure that they come out and get their vaccine. So we are very thankful, and if we continue working like this, I can see us in another couple of weeks to months getting to that herd immunity number. But we still have a little bit to go. In terms of the second dose, we now have 6,037 persons who would have been fully vaccinated, and so we're gradually now working to make sure that everyone who got their first dose would also receive their second dose. I want to say to people, come out. We have your second dose ready. And so for those who would have received the AstraZeneca vaccine, you need to look at your card because many persons would be coming due shortly. And you can receive your second dose between 8 to 12 weeks. So anytime in between there, you can get that second dose. I know on most of the cards, we probably would have put the longer date, and that is the 12 weeks. But there's nothing stopping you to come a little bit earlier if you would like to get your second dose. Most of the second dose that we have administered so far is the Sinopharm vaccine. And I think by this week we should start seeing more of the people who received the AstraZeneca vaccine coming forward to get their second dose, as well as those who would have received the first set of Sputnik would be falling due shortly, so they can come to our facilities and get the second dose of the Sputnik as well.
All right, Minister Anthony, thank you so much for speaking with us today.
Well, thank you.
Well, that's it for today's COVID-19 update. We've just spoken to the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.